Welcome to this edition of Mental Health Moments. We hope the mental health news and information shared here will empower you and your family to get on or stay on a journey towards wellness, mind, body, spirit, and soul. I'm Dr. Beverly Sargent, Executive Director of the District Heights Family and Youth Services Bureau. The YSB, or Youth Services Bureau, provides mental behavioral health counseling to children, youth, and families. COVID-19 is described as a pandemic, an outbreak of a disease that's prevalent throughout the world. Well, let's be frank, racism is also a pandemic that continues to infect and, in some cases, has impaled citizens of our country for more than 400 years. You may ask, what's the relationship between these diseases and mental health or mental behavioral health? Consider anger. While anger is a God-given normal emotion, the impact of anger on the human psyche can be devastating. Look at police brutality, rioting, and other violent behaviors. What about domestic violence and other angry outbursts made worse by alcohol and drug use and abuse? Consider depression. In many cases, a mental health clinician finds it challenging to determine if a person is dealing with anger or clinical depression, two illnesses with similar symptoms or presentations. Let's talk about fear and anxiety. Do you know anyone who's afraid to venture outside? Do you know anyone who fears going to the grocery store, to church, or other community gatherings? How about smoking cigarettes or marijuana? Or depending on other drugs just to calm your nerves? Yes, some people like the high, but there are others who feel like they need the high. Consider those who suffer from PTSD and other types of panic attacks that, as a result of COVID-19 fears and or the effects of racism and socioeconomical disparities. People have to cope. Gyms are closed. Many basketball courts and playgrounds are closed. Many churches or church buildings are still closed to large groups. Mental behavioral health clinicians have to cope and then help others to cope. In a few moments, we'll hear from Dr. Sylvester Howard, Associate Professor of Public Health at the University of Maryland, College Park. She'll talk to us briefly about teens, nicotine, and how we can help our kids say no to nicotine. More importantly, why we should prevent teen smoking in the first place. But first, if you or someone you know is finding coping with daily activities challenging, don't suffer alone. If you're in crisis, call the Maryland Crisis Line at 1-800-422-0009. The suicide hotline is 301-864-7130 or the general support line 211. You don't have to be alone. You don't have to be sad. There is help every day, all day, and all night. Remember, your mental health and your children's mental health matters. The District Heights Family and Youth Services Bureau is your YSB, and our sole purpose is to serve you. For appointments, call us at 301-336-7600. If you have questions and you'd like to email us, do so at questions@districtheights.org. Again, that's questions@districtheights.org. Due to a grant we received from the Maryland Center at Bowie State University, we're going to spend the next 8 shows concentrating on tobacco education and prevention. We'll include some vital information on weed, THC, and the teenage brain. Please stay tuned. This is certainly news you can use. In reference to news, the District Heights Youth Development Foundation is hosting its annual My Soul Knows 5K. This 5K supports children's mental behavioral health services throughout the south central areas of Prince George's County. The Youth Development Foundation working with the Youth Services Bureau, does not turn anyone away due to a lack of funds. So your support is crucial. The 5K is virtual, meaning all you need to do is register and run or walk any day, anytime, and anywhere you want. Visit runsignup.org and search My Soul Knows 5K. Soul is spelled S-O-L-E. After you register, you'll be sent your medal, your event bib, and your t-shirt. Remember, children's mental health matters. Let's chat with Dr. Sylvette Howard. Again, Dr. Howard is the Associate Professor at the Public Health at the University of Maryland, College Park. She and I will talk briefly about teens, nicotine, and how we can help your kids say no. More importantly, why we should prevent teen smoking in the first place. Tell our viewers and our listeners about your position and how it relates to the tobacco prevention project, for lack of a better word, in Prince George's County.
Sure. Well, I'm an associate clinical professor in the School of Public Health at the University of Maryland, and my background is in behavioral and community health. And as such, that encompasses a whole lot of things. And the Tobacco-Free Ambassador Program is one of those things that it falls underneath that umbrella. So when I did my dissertation work, I was really interested in what were the things that were actually like triggers to individuals that actually helped them or motivated them or encouraged them or even put them in that position where they engaged in at-risk behaviors. And during my internship and research time, during my dissertation and doctoral studies, I worked at one of the local Salvation Armies where they actually have a really great program working with individuals with either that they were substance users, etc., or they just ended up in different places in life and we're now trying to improve their way of life. And I did a lot of structural clinical interviews and diagnosis policies. And what I realized in my internship was that lots of these individuals ended up starting their behaviors when they were teens, or even as early as 10 or 11 or 12. A matter of fact, when I was proposing what I wanted to do for my dissertation, and I talked about the fact that I wanted to do these surveys with teenagers, and I was going to ask them about sexual behaviors and those kind of things. Some of my dissertation committee members said, I'm not sure if you should be talking about sex and stuff like that with middle school adolescents. And I said, well, if we don't talk to them about it,
it's happening.
Right? Somebody will.
That's right.
In fact, when I did my pilot, 2 of the girls in my pilot actually were pregnant and they were 14. So that just goes to show that oftentimes with parents or even with society, we talk to our teens or talk to our children about issues when we think it's the right time, but actually these things long before. And so going back to the Tobacco-Free Ambassador Program, the reason why that was so important for me was, one, obviously, we're not always going to be teens forever. So
that's right.
Teens often hear from us, but they hear from us as an adult giving them advice. But the information that they need is always important. But why not hear it from your peers? And that's how the Tobacco Ambassador Program came about. And so it's actually empowering young people with the information that they need to actually share with their peers, because that is the influence that they're getting. So that's how the program came about and my interest in it, yes.
Okay. So you actually developed this program and started it in Prince George's County?
So the concept actually was a merge between the Maryland Center at Bowie State University and the health department for the Prince George's County. And the Maryland Center, I had worked with them on several different projects before. And when the project came about, they asked if I would be part of the planning for the program. And so, yes, I've worked with planning the structure for it, the curriculum, those kind of things, yes. And I've worked with the program for now 6 years.
Oh, wow. Wow. I had never heard of this program before, and I'm wondering if this is like, if there's anything similar anywhere else in Maryland or even in the, DC, Virginia area.
This program is pretty unique. It came out from the Master Settlement Agreement back in 1998, right? Where
Okay.
it finally came out that, these big tobacco companies knew about all the information that they had denied before, but also that they had to give back money to the community. And I really appreciate what Prince George's County has done and that they've used that money so wisely in
Hmm.
they decided not only to just do broad education, but to empower leaders and to
Yeah.
do that with young people. And
Hmm.
so the program is not just only about giving them facts, but it's actually empowering the students and getting from them what they believe would be useful for their peers. And so we've worked with them to create messaging. We teach them a lot of their public speaking skills because some of them come in really shy
Wow.
and they learn
Right.
the information, but they're not sure how to share it. So we
Yeah.
talk about the ins and outs of public speaking and debating, etc. And even now,
Hmm.
with us being in this pandemic time, we still decided that we are going to do the program because
Oh,
it's
that's
still important.
wonderful.
Yes, and now it's evolved into a Zoom platform.
Oh, okay. How old do you have to be one of the teenagers taking part in it? Because I imagine once this airs, parents are going to be calling, wanting more information. And, how old do you have to be? And do you have to be a student in a particular school, in a particular area in Prince George's County?
Well, that's a great question. So the program is actually open to students across the county in high school, and we take the students as young as freshmen
Oh,
all the
wow.
way to
Okay.
senior. So
Okay.
actually, in our cohort this year, I have a few students who are actually in the program from since they were freshmen. And you would think, so
Wow.
that does that mean that
Okay.
they learn the same content each year? No, actually, they take on a different role. They actually, I actually give them something different to do. So then they help in the programming and they continue to evolve. Actually, we're actually having our awards ceremony tomorrow via Zoom.
Oh,
And
wow.
one
That
of our
is
ambassadors,
awesome.
yes, one of our ambassadors who was a junior when she was in the
Mhm.
program, she's since graduated from undergrad and is going to be starting her master's program.
Oh
And
my gosh, that's
so she will be
awesome.
sharing with the students about how the program worked with her life and developed her
Yeah.
leadership skills. And now she teaches and what she shares with them. So I figure it's like the gift that keeps on giving. And
Yeah.
so they just need to ask the guidance counselor at their school, how could their children be involved?
Okay, that's awesome. I love that. Anything that will keep, kids busy. And, just a little plug for the Youth Services Bureau here in District Heights. If you all need a partner, we'd love to partner with you. And if you have you done any PSAs or public service announcements, or is that something you all have thought about?
Well, part of the program, the students actually have to create their own versions of their PSAs and actually
Okay.
share it in their schools. So they do everything from the morning announcements, creating posters, doing skits right in the middle of the cafeteria, those kind of things. And
Oh,
so,
oh wow.
and then they've done some social media. This year, they've done a lot of social media. So they've used TikTok, they've used Facebook Live, Instagram Stories to create the messaging that they believe that their peers need to hear. So of course they get the
Yeah.
content, which is really important, and then they take that
Mhm.
content and transform it into messages for their peers.
Okay, well, you might have just answered my next question because honestly, we have done a lot of counseling with teenagers, and many of who smoke, but I have never talked to a teenager who wanted to quit.
Mhm.
What would you say to me as a clinician or to, these children's parents who are already smoking? What would you say to them to inspire them to stop smoking?
So, that's a great question. I would believe that, yeah, your experience is definitely one that many parents and many clinicians have experienced, that teens do not want to quit at that teenage age, right? Um, However, that is true, but one thing I also think is true is that they're trying to figure out how to cope with what's going on around them. So if you
Yeah.
ask them, why are you smoking? Right? They'll say, oh, it relieves my stress. You know,
Yeah,
oh, it's just,
absolutely.
why not? You know,
Yeah.
I've got a lot going on. Those are kind of the messages that you hear. And we
Hmm.
can't deny that. There is a lot
Right.
going on. If we just jog
Yeah.
our memories a little bit back to when we were teens, there was a lot going
Yeah.
on then. And now we are in 2020 with two pandemics at least that we are
Yes.
dealing with. There's a whole lot going on. And so my approach to that usually isn't to deny the fact that there's a lot going on, but is this the best way that you can cope with what's going on?
Hmm.
And
Wow.
then if we think about it, or is that the only way we can cope with
Mhm.
what's going on, right?
Yeah.
And also
Right.
to explain to them the physiology of what's going on in their body, and that their body
Hmm.
does feel as if this is the answer, and
Yeah.
what's going on in their brain, and that their
Yeah.
brain does feel like if this is the answer. However, the research does show that your brain will also feel like if this good behavior is the answer, if you actually were exposed to that or engaged in that, right? So those
Hmm.
neurotransmitters, the same thing that's going to work with the serotonin, all of those kind of things, all those things will be activated if we have positive coping mechanisms. And
Yeah.
oftentimes, I don't think our teens have that or have been taught those things.
Yeah. Yeah. Yeah, you're absolutely right. And so what I hear you saying is if a parent and a clinician can talk to their teen about how nicotine is impacting their bodies, it might make a difference in the decision making that this teenager is involved in.
Mhm. I do think that that can help. And also, I share with my ambassadors the fact that when you're a teen, you feel as if you're invincible, right?
Yes, that's right.
You know, you're at the best self that you know up until that time. And
Hmm.
the way nicotine works in our bodies, it doesn't start to really affect us in a way that we can really feel right away, right? It is doing stuff
Yeah.
to our bodies. We know this. It is doing stuff to our brain. We know this.
Hmm.
But really, it's about looking at our lives when we're going to be 30 something, 40 something, 50 something, or the fact that um, individuals on average are cutting their lives 10 years short. You know, we never think
Yeah.
we're going to be a certain age. We're going to be teenagers forever. We're going to be young forever. But, you know, showing
Yeah.
them, so different scenarios. So I actually do this thing with
Yeah.
them where I show them like different faces. Because, you know, when you're a
Hmm.
teenager, you just want to look great, feel great, everything. So
Yeah.
um, looking at these two faces, which face is more appealing to you? Which face do you think is old? Which face do like that kind of stuff, and telling them
Yeah.
actually this person on the left is younger than the person on the right. The person on the right, actually, though, they didn't engage in tobacco use. This person on the left did, and actually they're like 10, 15 years younger, but you want to be able to tell. Or let's look at
Right.
nails, let's look at teeth. You know, one day
Right.
you'll be the age of your big brother, big sister, you know, your
Yeah.
auntie or uncle, and you don't want to be looking like that. So I try
Right.
to
Right.
look at it from that lens with them, or thinking about athletics, right? You know,
Hmm.
you can be so much stronger if you weren't feeling as winded, or if you didn't have to leave the game to go and juggle or to go and smoke. You know, you can just
Hmm.
stay in the conversation, that kind of stuff. And so
Right.
they learn about that. And then lastly, you know, especially we're talking a lot about economic empowerment in our communities, and the conversation
Right.
is getting stronger and stronger. I tell them
Yeah.
about the fact that they lose about $10,000 a year if
Wow.
you engage in smoking. You have $10,000 less now.
Hmm.
Who are you giving that money to? and what are
Yeah.
we going to do with that money? So I try to look at it with them through those lenses.
Yeah. Well, you know what? It sounds like you are really personalizing prevention. And that is huge for parents and clinicians, actually. So it's not just that this teenager is smoking, but how is it going to impact you into the future? How is it hurting your pocketbook and your ability to be the best person you want to be when you get to be a particular age, or well, actually even today, the best person you want to be today.
Even now. Yep.
Yeah, and yeah, even using the word now, because that's what we have.
Right.
We have now. So what decision can we make today that's going to impact our future?
Absolutely.
I love that. And, I want to ask you something. I hope I'm not taking you
It's fine.
off the subject, but I know that you're a professor at the University of Maryland, and you started out as a counselor. Is that
My background is in mental health community counseling. Yes.
okay? Okay. So I have to know, how did you make that transition, or how are you integrating those two fields?
Oh, sure. Now that we could talk about for a long time, but in short, so I literally just less than a month ago got my promotion from assistant clinical professor to associate clinical.
Oh, okay. Congratulations. Awesome.
Thank you. Thank you. And so it took a lot of reflection putting together the portfolio package and everything. And I've always loved people, and I've always loved working in the community and trying to make people better. And one of my mentors, after I finished my master's, suggested to me that I take a class in public health. I took a class in public health and I fell in love with it. I knew that I wanted to affect change on a larger level, and I thought that definitely the way that I would do it was through psychology. And then I took that class in public health and realized that I could marry the two. And it is such a perfect marriage between psychology and public health, and it was a really easy segue into going into that field. Actually, I think public health is a great fit for many of our fields. And so with that said, I am able to work within the school, teaching students. I teach the Foundations of Public Health class, which is 400 students per semester.
Wow.
And,
Oh my goodness.
and I'm still smiling.
Yeah, that is crazy.
Right.
But way, in a good way.
It is, and it's quite interesting to do it online too. But so I teach that class, and then also why I love it is it gives me that platform to be able to, I feel, in change, right?
Yeah.
It's all about legacy behind, and how can you do that? Like, there's only 24 hours in a day, and there's only so much work I can do or you can do. But if you do take that time to do the mentorship and the teaching, you can spread yourself and multiply yourself anytime.
Absolutely, absolutely. One of the slogans that I like, someone shared with me years ago, is that when you can change a child, you change a nation. You change the world. You mentioned some of the current stressors that we have going on right now. Police brutality, COVID-19, fear in the Black community, not just the Black community, actually, people of color throughout the country, throughout the world.
Throughout the world.
Yeah. Have any of these, I don't want to call them incidences, but this fear going on, and for people of color, this anxiety, has it changed the lens at which you look through for your students, or for the ambassador program?
That's another great question. It really has. I also have the honor of having a special state appointment at the Prince George's County Health Department, where I work with the coalition, Prince George's County Healthcare Action Coalition, and lots of the change that we are working towards is policy, systems, and environmental change, so that PSC model. And it's a long-term model, right? And it takes a while to really see those changes that we want to see. But what
Yeah.
we have seen in the last 2 weeks, I think, has turned a lot of our theories upside down, right? Where that anxiety, that fear, that frustration has really reached a till that I don't know if our world on a whole has ever experienced. So maybe
Right. Yeah.
within states, maybe within cities, within communities, people have experienced that frustration, and we've all been on the outside looking in and empathizing, right? But right now, within all of that fear, within all of that anxiety, what we do have is a collective consciousness, right? And
Yeah.
it's not that we are all on the same page, because we're still definitely not. It's at
Right.
least some of us saying, there's so much more I need to know. I am choosing not to know. And or I have a lot to share. No one has ever heard my voice or wanted to hear my voice. And the fact that now we are at a point where everybody's voice should be heard, and we are
Right.
demanding that it should be heard, right?
Absolutely. Yeah.
So when it comes to these issues, the police brutality and COVID's going on, and where even do we get our information from? And who do we
Yeah.
trust and why?
Yeah.
Right?
Yeah.
So we can spend millions and millions and millions of dollars to try to educate individuals that you
Right.
wear a mask. You should wear a mask when you're going outside. You want to be at least 6 feet distant from someone else when you're out in the public. Yet
Mm-hmm.
a friend or somebody who doesn't even know all of the facts about health or anything, says, don't worry about that. You're more likely to trust them because you know that they have your back, right?
Right. That's true. Yeah. Yeah.
So when we think about education and when we're thinking about empowerment, we have to really stop now and pay attention to who are the voices that society says should be the voices, and who really are the voices that are being listened to, and work within our communities, work with
Yeah.
individuals, work within those other agents of change that have been pushed to the side, to see if we can get the right messaging out, because that's what we need right now.
Yeah. Wow. When you say agents of change, and when you describe what we're going through right now and use the word collective consciousness, I love that. And I hear another ambassador program being sown, you know? We're near the end of our interview, and I want to just give you the opportunity to say, or let me know, let our viewers and our listeners know if there's something that you want everyone to know that maybe we haven't talked about already.
Okay. Well, one of the things that I would love everyone to know is that deep within all of us really is the seed that can blossom if nurtured well. So what we have to do as a community, what we have to do as individuals, is nurture the individuals in whom we have the pleasure and the honor and privilege to interact with. So whether it be that little child or that older 95-year-old person, right? Spend that time to nurture that seed. And just like a garden, and I know it sounds really Pollyannish, but it's true, just as how you take the time to nurture a garden, you will reap the benefits later. And I really hope with all of the things that are going on in our society right now, that we take the time to listen, whether it's in our own families, whether it's in our communities, or even in the broader spectrum of life, to really listen and try to understand, and then to work towards the change that we want to see.
Yeah. Amen. Thank you so much. Take the time to nurture, take the time to listen, and it really will make a difference. Thank you.
I believe so. Thank you so much.
Thank you, Dr. Howard, for your time. We appreciate your willingness to educate our listeners. To our listeners, if you have questions or concerns, please email us at questions@districtheights.org. Thank you so much for listening. Until the next edition of Mental Health Moments, be safe, be wise, and don't be afraid to ask for help. Thank you.